Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to go over some Class 3 correction problems and things I think that people, even orthodontists, don't understand quite what I'm saying here. I'm not trying to insult your intelligence or anybody that's knowing about this. If you know this, well, just go on and do something else. But most people do not realize that this can be done, and they don't realize the difference in non-surgical and surgical orthodontics. I have scrubbed in on surgical orthodontics and worked on a lady for 7 o'clock in the morning till 1 o'clock that day, doing this, where you take the whole maxilla loose and you move it wherever you want it. Bring it out here and you shorten it in here and you section the jaw and bring it back. And this is a extensive surgery. It is very expensive doing it, and it can be done, and on some people it has to be done, and it changes the whole facial structure. But much of these, or many of these cases, can be done by doing something simple. And I want to stress this and get people to start doing this. I don't think too many people have actually done this. So let's get going on this, and I'll show you what we're talking about. Now, here's a neat young lady. This is 1987, and she's a Class 3. And you see the jaw is protruding out here, and these lower teeth are way far forward, too far, and the upper teeth are back behind it. So we're going to come in, and you can see the chin out in front of this now. On a man, that might not be too bad, but on a woman, it just looks bad. Now, the lower front teeth on a lot of these Class 3 cases are leaning back. They're trying to get back where they could be, and you have to bring them back, not just the crown, but you have to bring the root structure of the teeth back to do that. And that takes a lot of effort to get that back. Now let's go on here. Here is the model on the side. I've got now. What we actually do is we take this tooth out. What you do in these cases, and this makes sense, and I sat down and worked on this for a long time, coming up to figure it out. Now, a lot of these Class 3 cases, the upper teeth are tilted out this way, and the lower teeth sometimes, where the jaw gets out here, they're angled this way rather than angled back. So you've got to pull these teeth back a long way to get them to Class 1. See, this molar right here is out in front of the second molar here, and this is the second molar and the first molar here. So this tooth right, we've got to take this second molar out to where it'll be something like that in here. So we got to move it about 1/4 of an inch or more back in this direction to correct this. And so if you take this 6-year molar out, you pull these teeth back by pulling these teeth forward. In other words, you put some bands, a hook back here, and you push this on and bring it down here, and you're going to pull these teeth back this a long way. The point of this tooth will be back in this area right here now. And this makes sense, and it does correctly, and it'll work on this lady. I'll show you 20 some odd years after we completed this, and it's still there. And we have a lot of times people will go in, I'm going to erase this right here, and they'll try to do just a single jaw correction, like they'll move the mandible back in this direction and not do on the top do the top one, because this is back. You have to go in and section this whole maxilla loose and trim it down sometimes if you got too much vertical height, and put it back and hope that it grows back where it should be. And that is a hairy operation, I'm telling you. Now, to keep from doing this, we can come in and take this tooth out right here and bracket all these teeth up. Everything's bracketed up when you start this, and you hook up and you bring class 3 elastics on this, and you pull this back while you pull this forward. Now we want these teeth to move out, so we put a lip bumper in the front part of the mouth up here to run interference. When you're moving a group of teeth forward or you're getting them out against the lip pressure right here, the upper is not as bad as the lower. You really have to do this on the bottom. You have to put a lip bumper and run interference for them. So you've got a soft vascular bed here to move those teeth into, and they'll move out there. And I'm going to show that in here. We're going to run through some pictures real fast here in a little bit. And this is what we're trying to do. We're trying to get these teeth back, and I don't want to pull them back. They're kind of lean back this way. We want to get the roots back, and I'll show you we got them back. And it left the pagonian of this part down here sticking out where it originally was. All right, let's get going here now. They lower the upper arch, and you bring it forward like that. You have to widen it out some. So we used a 040 Big Daddy arch wire to widen this out. And you can widen anybody's jaw at any age, at anywhere, and it doesn't matter what color they are or anything else, their teeth will expand. And so we expanded it with that large arch wire right in there, and we used a lip bumper up here in the front part of the mouth to run that, to bring those teeth forward. All right, the lower arch was crowded down here. This tooth is turned sideways, and whenever you have a lower anterior tooth turned sideways, when you turn it back around, the tooth is really shaped like it's different, like you have a lower anterior tooth or something like that. And then down here where the root is, the tooth is very thin in this area. Like if you cut through up here, this is wide. It'll be spread out pretty wide, but the root itself would be kind of thin. But when it's sideways, you've got this thin part sticking out, and you turn that around, and it's almost impossible to do that without pushing this tooth through the bone structure, and you'll tend to lose some of the bone coverage of this tooth right here. It'll kind of move through a little bit, but you watch that. We'll bring that around and bring it. You got to torque it in or bring the root back in more to get it to stay. Now this is out wide. These teeth are out in this area, and we're going to extract these 6-year molars. All right, here we have done that now, and we've brought these. We've taken these 2 teeth out. And by the way, this lady had some periodontal trouble, and it wasn't bad on her, but in the family they had a tendency to get periodontal problems. And a lot of people in the family had that problem. Now these teeth right here, we're going to bring them back, and you watch this, what we call pagonian, and this is right down through here, and it'll bring these teeth will come back, but this stays right where it was to start with. Okay, now here is along the way. Now here it is where this is sticking out right here, and these teeth are out in front, and we're going to bring the roots of these teeth and everything back. And this is 1987 right here when we did that. And we're moving these teeth forward. You see they're laying down, but we want to bring them out here, so we put the lip bumper in that area. Now here we take these teeth out, and then we got a periodontally involved tooth that we're bringing up here. And I asked this young lady, I said, "Do you smoke?" And she said no, she never had smoked. And I said, okay, we can probably bring this tooth up without any damage at all. We got long roots on it, but she's lost some bone structure on that tooth. And we're taking a better one here and bringing this forward. And you watch this, when we get it in there, we'll have good bone structure on that second molar when we move it forward. In other words, these teeth are going to move out till this is something like that. And there. All right, here is the opening now. We extract these teeth, and the day, or you send her somewhere to get them out, and send them right over and have gauze in there and have everything on there to start with, and you can move these teeth in just a few months. So you don't want to let this bone grow across and form cortical bone, and it's harder to come back with that. Now we're going to bring these teeth in a forward direction, both in here, by pulling these teeth back. These teeth are going back here. Now we put in something here, and in this archway we bend this down this way. As we pull these teeth pull on this, we don't want these to come forward, so we don't have to do much of that. We're bringing these teeth back to the molar teeth, or trying to. So we're going to be pulling from here down to here. Now watch how this works. Now we pull on that some more, and you see these two teeth are kind of lined up. This is the second molar, and that's the first molar up here. And we continue to pull that forward, and you'll see finally we get these second molar here is underneath here, almost like a first molar. Now the wisdom tooth is kind of left behind in here. We're moving this through here. This is something that people are kind of afraid to do. Well, I guess that is because I don't see hardly anybody doing this, actually. And this is preventing a double jaw surgery if you went into surgery to get this corrected properly. All right, now here we go. And this is, she's age 28, and this is 90. We stopped on this and waited to let this kind of heal up. Now this is that tooth with periodontal trouble, and it is right up against this area. And this is the first molar right in here, and the bicuspids are coming down in the right spot. And we go like, all right, I'm gonna run through how we did this, and we put a little flexible wire up in here to start with, just to line the piece up. We start turning this tooth around, but I wanted to get the gap big enough so they turn it around and try to keep from losing some of the bone structure on the front of that lower tooth. So let's get on through this pretty fast now. We've got this done in slow motion if you want to go back and get another deal of it. Here we were using the little plastic brackets in the front, and we're bringing those teeth, they're bringing them forward in here. Now, okay, and we're pulling these back, but I wanted to get this back good before I try to turn this around right here. Now here it is a little further down the line. You see it's showing up already in the face, in the structure. We're turning that tooth around and gradually moving it around, and we take some time doing this. Now when I get this space big enough, we will rotate this too, and we're pulling these into the gap and leaving these out where they are for the time being. See, we got this elastic chain wrapped around those teeth there. Now the upper is coming forward. All right, we're moving these back, or doing most of the force on them, and we're trying to widen this out up here in the front, bring the cuspids back, and bring the roots back on them, and we're turning this tooth around as we increase the space size right there. Now we used a large arch wire, which you can get all the buckle pressure you need here, and we probably get a rectangular wire there to get a little buckle root torque on that. And if you do it really good, there you have to do that. And that's the upper, and that picture is not too good, but you can see where this is pulling these teeth out more back here and less up in here, and there's very little effect on the front teeth there. Now, here, this is along the way that we've already shown these are together here. Now we've made space in here now. We line these teeth up. Now we're turning the cuspids around, filling that up, and we're bringing all of these front teeth back. But as they go back, we pull the upper forward. So we're giving the tongue room up above where it did have room down here. And we're going to hold this in that position while the tongue gets used to that. It may push the whole thing up out to some extent, but we have a method of using class 3 retention. You need to look at that. All right, we've got this, and you see this kind of stripped a little bit right there, but not much. And we're bringing this back, and I've got torque on these teeth. I'm going to bring the roots of them back in here as we're bringing these teeth forward, and we want their roots to come, we want the roots of these teeth to come out up above like this, and the ones down there to go back. And so that's where they normally would be when you don't have the class 3 problem. So here we see this is coming back, and we're watching this tooth right here. I'm going to torque it in, bring the root into the bone structure. But you can't torque it when it's sideways, or it's very hard to stick a bracket on this edge and torque it in and then turn it here. So we lose a little bit of bone structure there as we do the case. Now the upper is coming forward, and we're bringing the roots of them out, and we're bringing the roots of the lower ones in toward the tongue. Now this is looking a little better right here. You don't have much loss here, and we're going to show you a lip bumper up above. And we're bringing that out, and we put some buccal root torque in those upper teeth. Now we're about halfway close to at this. This is 1988, and she gains a few pounds. I guess she's not eating the same thing she was eating before, and you see she's a little fuller in the face, and she loses this weight, and she gets over that as we treat her. You can see the tissue on this tooth is getting better. We're torquing the root. It is going in toward the mouth, and the crown is staying out. Up here, we're bringing the roots out and holding the crowns where they are. So we put a lip bumper, and we run interference. We keep the lip bumper out away from the tissue so that the root structure can move forward, and the bone has to perform underneath that soft tissue layer in front of it. If you have a pressure on it, you can't get the bone to come out there, and it'll keep the tissue from coming out. So you got to use a lip bumper and run interference for it like that. You can see this space between the lip bumper and the tissue, and that's necessary to do this. And now it's looking almost normal here in the front. And that lip bumper, let me see, you see where it fills in, and you can expand this lip bumper as the teeth get further out. You need to expand that, and this is one we just make to fit there, and it fits in the upper tube here. This is an 018 square rectangular 1/8 by and it's 1825 arch wire there that we build the lip bumper out of. Now it's bringing this whole group of teeth have moved forward into pretty much class 1, and we've just about got these teeth closed all the way up in here, and this is 1989, and we started 87 or something. It's going to take it takes over 2 years to do this, and that may be the real problem here. Now we can get this out with the double jaw surgery. The surgery back then was about $40,000 or $50,000, and I don't know what it would be today to do that. And this takes some time, but it's almost just in the regular orthodontics. This tooth now is almost normal here, bringing the root back in. And these teeth are closed up just about out, and these teeth are further out, and the roots of these teeth are out, and these teeth are in. So we're getting what we wanted with that. And the lip bumper, we keep expanding it as these teeth go forward. Now this is 1990. And we were slowed down there for a while. I was dealing with that tooth that's got the periodontal bone loss on it. And we get it out there where it has the stuff almost completely. Here we finish up 1991, and we've got a bite plate in there, and we've got the bottom closed together now, and this has taken about 3 years to do this, but this lady didn't go through a surgery. If you're in a big hurry, do that, but I'll tell you, if you would scrub in on one of them, you'd be glad to just do this slower and say that. So she lost a little weight. It's 91, and she's back to normal. And this is the way the teeth fit. Now this is 1987, 2 of 87, and this is 8 of 91. So that's a considerable length of time doing this period. She doesn't scale her teeth good, but this is the way it held up that long. Now I'm going to show it to you later. Several years later, we found this lady, and we got some pictures of her, and the teeth are right where they were. And that's the 040, and you see how much bigger, how wide this is. This is not near as wide in here. And we just measure this across in that area. So we widen this out with that large arch wire. This tooth that was turned around is lined up perfectly fine now in here. And here she is, and this is, I think this is, I don't have the date on it here, but this is recent pictures that we took maybe a few years ago, but we saw her about 20-something years after we finished, and the teeth are right in that same position right there. I think I've got some pictures here in just a minute. It's going to show them. And that's, see, this is a second molar and a third molar. By the way, you got to have wisdom teeth if you do this. when you go down, at least lower wisdom teeth. But on the upper, it wouldn't matter. And that's in a class 1 relation here. And these roots are going back, and this is coming up in here. All right, here is the cephalometric x-ray after we finished. You see the pagonian is still out here, but these teeth are back, and the root structure on them is down in here. And this part right here is moved forward, and these teeth are in the bone good too, right there. There it is from the panoramic side, and you can see these teeth have moved from here up to here, and that's a class 1 relationship there. And that's 19, I can't get that's the panoramics 11. Now we went off and left the wisdom teeth up here. Now they come down if you that bothers you, you can take them out or do something, but we would leave them in there. If you had a bad tooth here, you could move it over and put that in the hole. All right, here it is, 1987 right here, and here it is, 2010 right there. In other words, from 87 to 2000, say we got about 12 to 13 years there, and then we've got 10 over here, so it's about 22 or 3 years later, it's still working good. And this is the same thing. Now it is 87, 2010, right there. And then we widened that out, and it stayed out there. And that's 2010. And I know where this lady is today. I haven't gotten a picture on her, which that was 2010, which is 23 now. So she's still got these teeth in that position, and it's almost, it would be 20 or 30 some odd years later. Now look where pagonian, I didn't move it back, but we moved these teeth back. You see where they were here to start with, they were out in front. Now they're back underneath here, and this pagonian is still out like that. And there she is in 87, and this is 2010 right there. Now, that's a little bigger picture, but that's the change that's made. And this is staying like it is, and it holds up good. So, when you smile, you can see the same thing. And I hope you get the idea here that this works, and you can do this on people and move the teeth, move the upper teeth out by moving the lower teeth back. I'm sorry for that, I lost the picture there, but anyway, thank you for watching, and I hope you learned something from this, and go ahead and try, if you're out somewhere, especially where they can't do the surgery, and this is an economical way to do it. It may take you a little longer. We spent a lot longer here waiting because of this periodontally involved molar. So I'm going to close out and say goodbye, and I'm going to say good stop.